Thanks very much for coming along this evening. I'm very pleased to get a chance to talk to you. So, I'm going to start with a question. Okay, my question is, why do some people grow older but remain fit and active and independent, whilst others grow older but they become more frail, they develop those chronic diseases of aging? Why is this? Is this just a random process? Is this something that's maybe enshrined in our genes? Is this something, in a sense, maybe it's related to something like the choices we make, the behaviors we adopt? Maybe it's about not smoking, having a good diet, maybe, and getting some exercise. Well, actually, yes, of course, it's all those things. Those things are very, very important. But what I want to do tonight is I want to talk to you about two other ideas, okay, which I think are very important, not only for understanding the notion of aging and its impact on chronic illness, but also in terms of the responses that we should have and that particularly governments should have in terms of looking at the issue of aging, okay? So the first idea I want you to hold on to is the fundamental causes theory, okay? So the fundamental causes theory holds that across history and across societies, what we tend to find is those people who are advantaged in terms of social and economic position, they tend to have less of a burden of disease and they tend to have longer lives, okay? And this was true when the majority of people died from the big infectious diseases. You know, there's things like diphtheria and measles and tuberculosis and typhoid, the kind of thing we don't hear about anymore. It was true then, and it's true now, that the biggest causes of death are cardiovascular disease and cancer. Okay, so this is a really big change that we've seen in our society, and it's something that the fundamental causes theory tries to explain. And it does so by putting forward the very simple idea that people use the resources that they have, of course, they mobilize those resources, so things like their knowledge, their income, their prestige and their power, they use these things to try to limit risks and try to adopt protective strategies, okay? So resources matter. Now, we can see, in a sense, evidence of the impact of these processes in all of the societies where we've cared to look. And I've done a lot of this kind of research myself. But actually, what I want to do, first of all, is I want to tell you about some US research that's been done. It's been done just up the road here in Harvard. Nancy Krieger has done lots of research in public health. And what she shows is that if you sort of rank people in terms of income, okay, from sort of the lowest incomes to the highest incomes, what you find is that the people on the lowest incomes, they have 64% higher risk of premature mortality than these people here on the highest incomes. So there's a big difference in these things, and it's not just about mortality. We also find that those people at the lowest end of the income distribution, remember, low down here, high up here, they also have very much higher rates of chronic disease. They're going to experience chronic disease earlier in their lives, and it's going to be more disabling for them. Okay? Now, of course, this is a real tragedy for them. This is going to be more pain. This is going to be heartache. This is going to be very difficult for them individually, and that's a concern. But it's also going to be a big concern for our societies, because, of course, people are living longer. We have an aging society, but many groups, particularly these here at the bottom of the income distribution, they're living for longer with chronic diseases, which we're spending, and societies are spending a large amount of money trying to treat and to stop them being disabled over. That's a real problem for the sustainability of our health and social care systems over time, because it costs a lot of money to treat these people. And it costs a lot of money, particularly in a society like the US, which is already spending something like 18% of its gross national product on healthcare services. Okay? So that's the first idea. The second idea that I want to put forward to you is the idea that the life course perspective should be something that we should adopt. Now, what's the life course perspective? What this suggests is that when we try to understand chronic disease in older age, when we try to understand the distribution of that chronic disease, what we should do is we should look to the experiences and to the environments that people experienced earlier on in their lives, maybe even to the period before they were born in the womb. In fact, we know that that's true. Now, you're probably looking at me and thinking, Richard, this is not a startling revelation, okay? We had kind of realized this ourselves already. And it's true, it's very true that we've known for a long time, haven't we, that people who've led a harder life, those who have had lots of knocks along the way, they're going to have more illness later on, and they're probably going to die earlier. And similarly, those diseases of childhood, okay, you know, like polio, cystic fibrosis, they don't go away just because you've grown into an adult. Okay, so we know that the life course perspective is something that's always been with us. But what is new is that we now know that to understand that distribution of chronic disease later in life and poorer, worse aging for individuals, we have to understand the growth trajectory of the child, that this is very, very important. We have to understand the accumulation that the child makes in terms of its physical, psychological, and social health and well-being. Okay? Now, this is a fundamental change in our perspective. Prior to this, what we kind of assumed is that children arrive in adulthood, over here, with around the same levels of health, and then over time this is chipped away by the vicissitudes of life, bringing on chronic illness, disease, and then death. But actually, what we found is that often it's the steepness of this growth trajectory and the ultimate level that you get to that produces the resilience to these later aging developments. And that's a really important change in the way that we see the aging phenomenon. Now, the good news is that we have the data and we have the information to be able to study these processes now. So, for instance, my day job is looking after a longitudinal study of children called Growing Up in Ireland. And Growing Up in Ireland follows around about 20,000 Irish children through time from the age of 9 months of age. And it's really exciting. We have fabulous data that we can follow these children with. And it allows us to examine processes. For instance, we can look at the fact that children who are exposed to tobacco in the womb, we can look at the way that that influences the growing brain and then the risks that they are going to have of developing externalizing illnesses like ADHD and then the impact that that has on children. We can also study things like the way that early diet influences the child's risk of overweight and obesity, and then the impact that that has on the early signs of metabolic disorder and later cardiovascular disease. This is really exciting stuff because we can follow children through time. For people like me, it's very exciting too because we can also follow the process over time, the pathways. I like to think in a sense that these longitudinal processes are down to 3 basic kinds of processes. The first kind of process is what you might want to call pathological development, okay? Pathological development comes down to the fact that the human body in development, particularly in the utero, is really only going to be able to use the resources which are available to it. And where there are limits on those resources, that can have long-term consequences for the body. So a really good example of that is the way that the child's growing organs can be affected by the experience of deprivation in the womb. And so, for instance, the kidneys might be underdeveloped. And that leads to a long-term risk of experiencing high blood pressure come older age, as age begins to impact on function. The second P, these 3 Ps that I'm talking about in terms of the processes of aging and the effect of early life on this, is the idea of plasticity. And that's the idea that the human body, when it's developing from a young age, has a limited capacity to try to adapt to the outside world that it's going to face, given the signals that it's getting from the maternal environment that it's in. And often this can be adaptive, but sometimes it can be maladaptive if the environment that it subsequently goes into is not the one that it's expecting. And so what we find here is that you find sometimes epigenetic changes which have long-term influences on outcomes for the child. The third P that I want to put forward to you here, third process, is the pathways that the child follows, which are very important. So early life might shape the subsequent experiences that the child has. This can be their physical development, their psychological development, or their social development, shapes their subsequent pathways that they follow and the risks that they then face in terms of the threats and adversity that impacts on health. Now, what we've seen here is the development of an understanding of the way that all of these complex processes can interact, okay, to produce exciting insights into the causes. And of course, once you realize the causes, once you get these insights that Luke was talking about earlier on, that we as scientists like to try to achieve, what you can then think about are the interventions to try to change these things. So what we find, for instance, is in some of the research that I'm engaged in, we have previously tried to understand the way, for instance, that poorer children seem to do worse in education. We've never really understood why this is really very fully. But now we can study, and I have been studying, the way that the experience of financial strain on parents impacts on the cognitive and the psychosocial development of the child, with an impact on its subsequent education, which of course, as we know, is one of the major mediators of the occupational position they're going to get, and their risk of unemployment, the risk of poverty, and then the health threats that that brings with it. Okay, so we can study all of these kind of processes in more and more detail. It's really exciting. And we do it not just using data in childhood, like growing up in Ireland. We also have a longitudinal study of older people in Trinity. It's called TILDA, the longitudinal study of aging in Irish society. And we have really detailed, nuanced data on the medical conditions that older people have, and we can look back across their lives and try to see the early experiences they've had and how it contributes to the lives that they're facing now. This is really exciting, and it's something that Ireland has spent somewhere in the region of about 45 million on over the last 8 years as we've been developing these data, and I am really quite blessed to be able to use these data and do the research that I have with them. And we're seeing the emergence of this developmental science that brings together social scientists and natural scientists to carry out research. So it's quite apt in a sense for the theme of this little event, because fusion is exactly the kind of area that I work in. I work with natural scientists. In fact, I'm really pleased to say that Horizon 2020, the European Commission's new funding program, has given us money for the next 5 years to be able to study these new processes of how the life course relates to disease in older age. Now, at this point, hopefully, you're putting together these two ideas. Do you remember the fundamental causes theory and the life course theory? Well, you're putting these two things together and you're beginning to think about the policy implications of this. And I think it's a really strong one. The policy implication of this is that if we want people to have better aging, if we want them to have less chronic illness in older age, what we've got to do is we've got to think about intervening earlier on in their lives. In fact, we've got to think about intervening earlier than birth, to when they're in the womb. Now, this was put really pithily by a British parliamentarian called Graham Allen, who came out with a lovely quote for this, and I like to get this out every so often when I'm doing presentations. He said that if people keep falling off a cliff, don't worry about where you put the ambulance at the bottom. Build a really big fence at the top and stop them falling off in the first place. That seems to me a real truth. Thanks very much.